And welcome back to Fresh Outlook, everybody. I'm TWB. With President Obama reelected, House Speaker John Boehner has reminded us all, last week in fact, that the presidential election confirms that the Affordable Care Act, also known as Obamacare, is the law of the land, and it's here to stay. Take a look.
What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law.
During his campaign, Mitt Romney stated several times that he would repeal Obamacare on day one of his presidency. But with the re-election of Barack Obama, the plan, also known as the Affordable Care Act, is clearly here to stay. It's supposed to extend health coverage to more than 30 million uninsured Americans beginning in January 2014.
Today's decision was a victory for people all over this country, whose lives will be more secure because of this law and the Supreme Court's decision to uphold it.
But what that will look like for actual consumers is not yet settled. States now have to decide whether to craft their own insurance exchange program or leave it to Washington. Many people still have questions. Whose health care will become more affordable? Who will have to pay more? Who will still be left without medical coverage? Does the plan still leave insurance companies in charge? And is Obamacare just the beginning of a U.S. healthcare reform?
Lots of questions. I'm eager to hear what the panel has to say. As the package stated, 30 million uninsured Americans, that all changes January 2014. Do you say yay or nay on Obamacare, WJ?
Well, it's really Romney Care. It's the same program that was implemented in Massachusetts, and now we got it. And I actually never felt too good about it in the first place. The idea of actually the empowerment that's going to take place for insurance companies, infusion of capital into insurance companies. I just simply don't trust them with that amount of money and having that much amount of power and control in our society. I'm not a big fan.
Not a fan.
Well,
okay.
Yay for me.
Yeah.
And
tell us why.
Yeah, for I think two main reasons. One is we've been moving to what I call an a la carte society, or an a la carte economy, in that through sort of privatization of a variety of public goods, of education, of health, and that has been forcing and putting more risk back on families, back on communities.
Lots of risks.
And so these families, again, our Alice family I've talked about, right? One of their child gets diagnosed with cancer. They are now, or they have a pre-existing condition, which the Obamacare will helps people out with. They are now, in the absence of Obamacare, they would be actually be much more in much more jeopardy. I think this is great. It really moves us away from. It's about time. It moves us away from this a la carte society that we've been progressing towards.
Yeah, I mean, I agree. I mean, it was unfortunately from the get-go. We saw, the Clintons try to get this off the ground before it never happened. That's why it was such a big deal for President Obama to do it. And of course, he enjoyed his first couple of years and then got the payback in the midterm elections in 2010 when the Tea Party sort of took over and made some changes. But the bottom line is with Obamacare, or Romney Care, as it's been also known, I was the recipient of it when I was in Massachusetts a few years ago. I had to have a cancer procedure, whatever taken care of when I had left one job because of the fall of the economy in 2008 in Florida, and I was at the time collecting unemployment in Florida, but I was moved back home to the Massachusetts area, and I had this immediate, sort of need.
Did you buy your own policy, or actually was that a policy that someone provided you with in Massachusetts?
Well, I was just about to explain that they give you some options with Massachusetts in the Massachusetts Healthcare, which is the Romney Care, Obamacare, in order to select which doctors and whatnot that you need to do.
So like an exchange, as they're talking about, like a marketplace exchange?
Exactly. Okay. I mean, you're not actually paying into it if you don't have an income.
Right.
So all I can say is that helped me at a critical time, and I did not rely on it for more than I needed to rely on it. And as soon as I was able, I got a new job and I moved up and I moved on, and then I supplied my own health insurance.
I can't say that most people would do the same thing you said you did.
But I mean, I do
not take
think
advantage, so to speak.
Well, I think that's part of what there has to be a certain public trust, right? There's a certain public trust. If there's a philosophy and only a mentality, as we just saw Mitt Romney say in new videos and new recordings that were posted recently about the majority of Americans, that he felt as though because, if I'm paraphrasing here,
47%?
Yeah, 40. He said that basically, of course, the people are going to elect the person person who gives them free stuff.
Right.
And he was referring to Obama, and that was sort of a reiteration of the 47% comment. What we're really trying to do is establish a public trust where you're not going to take more than you need, okay, but we're going to be able to provide you some basic services so that you don't fall further when things go down.
Right.
And the other piece here and why I like it, and this comes from also teaching in a public policy school and a planning school, is that we have now made the acknowledgement that many of the health problems we have today are not essentially Medicare, but healthcare problems, but they are public health.
Yes.
They are public health problems. Childhood obesity,
Right.
cancer, certain types of cancer. These have become public health problems. And so the way and one of the things that distinguishes public health from medical care or healthcare is being much more proactive and preventive.
Well, that's why Obamacare is much more of a preventative plan, and that's why we've seen even in California they save money and sent insurers money back and stuff because they were able to, sort of keep this. But when you're talking about covering people who have pre-existing conditions, when you're talking about children up to the age or young adults up to the age of 26 years old being able to stay on their parents' insurance,
covering up the donut hole on Medicaid,
on the elderly, so that they don't have this deductible of $5,000 that they're going to have to pay for prescription drugs when you're old, you're not working, you're on a fixed income with Social Security, and potentially something small in terms of a pension. Who are the people that that Obamacare is going to help? It's going to help a range and a host of people, from young people to people who are old and your grandparents. And I think that that's what people need to sort of get a grip on. And you can still choose. You can elect, the different kinds of providers that you might have. I know that there's been some flack from some folks, like the pizza guy from what do you call it? This pizza guy. You know what I'm talking about?
No.
This. Who's the?
But I love pizza.
It's
so
a famous pizza chain, and the guy was basically saying it's going to hurt me.
Papa John's.
Exactly.
Okay,
Thank
yes,
you.
yeah.
Famous pizza chain, and he was
going to say Herman Cain.
that's another one. Yeah.
Right.
But the Papa John's guy was basically saying that Obamacare is going to kill my business. It's not going to kill his business because he doesn't have to send people to the emergency room and pay for the emergency care and the kind of care that Romney had suggested was sufficient. He's actually going to be able to have a healthier workforce, and they're going to take less days off, fewer days off, and they're going to stick around. It only costs $70 a day. I mean, $70 per person to have Obamacare. That is not a lot of money to keep America
Over what period of time? Like what's
healthy.
I didn't understand that stat.
Annually.
Really? Is that official? That's the official count? Okay. Well, I just wanted to add a personal anecdote. My brother's a doctor in Las Vegas. He's about to become president of the Clark County Medical Society. He is a huge proponent of Obamacare, just in terms of the medical standpoint of how many people come into, that he's been affected by. They don't have health insurance. The hospitals have to cover it. The contracted rate of insurance companies goes up. Ultimately, it affects us. My brother is a huge proponent of this just from a medical standpoint.
My mother's a physician. She's been doing it for 45 years. She also has her master's in public health and epidemiology from Harvard as well. And the bottom line is she feels exactly as your brother does, because there are too many hoops and things for people to have to jump through already through the insurance and through filings. And she sees, as an emergency room physician, and has been for 45 years, she sees the people that are coming in that don't have regular preventative medical care.
But the question I asked my brother, and he didn't have the answer, was in terms of whose premiums do go up to cover this. Is it yours? Is it yours? Is it mine?
I'm shocked.
I'm
shocked
how are the
actually to
premiums?
hear.
Because I've been looking for premium sort of research, and I can't seem to get an answer because I don't think there is an answer yet.
I just got to say, I'm shocked to hear the response of your mom and your brother.
Really?
Because the doctors that I know are they're not feeling real good about the direction of things. They're seeing, and it's not, by the way, I was going to clarify, I think that we could have gone a great deal further in nationalized health care. I think the models in Great Britain and Japan and Canada are more what I had in mind, and I just wanted to clarify that, because there's nothing, I'm opposed to national health care. I'm not. But on the other hand, I think doctors, the ones that I know, feel greatly threatened by the direction of things and are concerned about actually the quality of their incomes over time.
He's a caretaker. He wants to see health care provided to everyone. Everyone is entitled to it. So in terms of also this question, the states deciding whether or not Medicaid is covered for the lower income families, the states need to decide this. As a healthcare provider, as a doctor, why would you not want to, allow everyone in your state to have that coverage? I mean, it's why they become doctors and nurses. I mean, so that's why I'm surprised to hear that doctors
Well, it's the
don't
federal
support.
government,
It's not
like
about the
Medicare.
money. Doctors don't make money anymore. I mean,
Well, is that-
that's a
is-
fact.
Well, is that part of the response? Is this feeling that they may be that this socialistic sort of grab?
They'll be
is-
taking less of
making
services
less
that they can make more. Look, I don't think it's right that a doctor can look in your mouth and make a Mercedes payment. I really don't think that's right. But on the other hand, there's a certain expectation. I mean, a specialist in this country earns $300,000 and up. That's kind of what they expect to make, given the outlay to go to medical school and so forth. And let's just say there is a significant segment of that population that is greatly concerned about the direction of things.
Sure.
On the
And I think the only thing I would say to them, and I have colleagues who are, feel the same way, is that when we do our little benefit cost analysis here, right, that we need to not only incorporate as many of the various factors today, but we also have to look into the future.
But we're in a right now society in the U.S.
Well, but I think one of the sort of fallouts of the Great Recession and this very weak recovery has been, I think, many Americans have sort of pushed the reset button. That many Americans in my travels and my talk with my students, I was already starting to say, well, yeah, we're living beyond our means. Right?
Oh,
absolutely.
Absolutely. I think people would much rather just
stability.
have a roof over their head than the 5,000-foot mansion that they had once had over their head.
Or I just want health care. I mean,
Right.
I do some work. I do
you-
some work with the Freelancers Union out of Brooklyn. They're actually the fastest growing union in the United States.
But you know what? That union isn't so great because you have to pay out so much money for your deductibles and for major procedures that yes, it will give you and allow you to fit into the mandate, but it doesn't give you the kind of health care that you would have if you were able to provide, yourself with a better choice.
Well, I guess all I just want to interject here is that they're fastest growing, and these are people who are freelancers. They're independent writers. They're photographers. Temp workers.
Right.
And one
Adjunct
of the,
professors.
And one of the key things that binds them or connects them is they don't have health insurance
Right.
or many of these other benefits.
Right.
And so maybe it still be very
No,
costly.
I mean, and one of my friends who works at the UN,
but it's a potential solution.
But I've looked into it, to be honest with you, and to be honest, it's not really that great of a plan in terms of what you're going to have to pay for. Yes, it will get you a basic level of care, but it's mainly catastrophic insurance. It's not really the kind of preventative care that you would have if you were able to go in for regular visits and that kind of thing. And that's the part about it that's troubling. It will allow you to comply with the law by 2014, so it's good to know that it's out there. But on the other hand, it's not the kind of insurance that, Father knows best that you get when it's Mr. and Mrs. Beaver and you get to go to the doctor all the time.
But again, depending upon the alternative. Right?
Sure.
It's a start. It's something. I'm kind of a fan of that catastrophic health insurance. Myself, when I've had strong coverage, I've always noticed that I tend to go to the doctor more and I'm less healthy. I am more into prevention. When I'm not adequately covered, I am super strong. I'm super healthy. My diet transforms. I'm in great shape.
So does this mean that the health of our country just plummets as soon as...
I don't know.
Is that what you're saying on a greater
listen, this is the
scale?
laboratory I'm kind of doing my research in right now.
It's like a self-fulfilling prophecy. What do you say? Republicans say that Obamacare hurts the small business. Do you agree? Disagree?
I can see why they'd make that argument.
Okay.
I mean,
is that enough of a reason not to put it through?
But you don't have to.
I think we cited a whole set of other benefits that exceed the cost.
I don't think it
you mean
hurts
in
the
terms
small
of
business.
actually small businesses having to take a certain amount of their profits, taking off the top, and paying health insurance for their employees.
But there's tax incentives. I mean,
If
so
I
think
small
the pros
business,
outweigh the
50
cons.
people
have an
or less, you
accountant here
don't
to do the
have to
crunch numbers
provide
on
it.
this?
You don't have to provide health insurance for your workers if you have 50 people or fewer. If you have greater than that, and that's still considered a small business, but if you have greater than that, then Obama requires that you have a mandate to provide a health insurance option for your workers. So it's not every small business, because not every small business is greater than 50 people to begin with. Secondly, I think that, again, going back to the Papa John's argument, it was whether or not it was going to be better for his workers to be able to have more preventative care, or whether or not it was just, if they had to get sent to the emergency room. And the cost-benefit analysis was pennies on the dollar on that.
Let's just bring up the idea of immigration. 10 to 12 million illegal immigrants in this country will not be eligible for Obamacare. Is there a solution? I mean...
Falling through the cracks. They're the ones that are falling through the cracks.
Well, that's comprehensive immigration reform. That's
Right.
another issue.
Right.
Okay.
I mean, the reality is that even if it's targeting the 30 million people who are uninsured in this country right now, of which I know many people who are in the middle class who've just lost their jobs or between their jobs or however it is with their new job is offering, like you say, a la carte, so they're getting paid to do a service, but they're not getting health insurance along with it. You know, those are the kinds of people that would benefit from, I think, Obamacare more than the average person.
Well, just go ahead.
Yeah, I was going to say, actually, when you mentioned actually illegal aliens, illegal immigrants, I'm sorry, what's the correct term?
Undocumented workers.
Undocumented. When you're talking about actually their entitlement to health insurance,
What about the children of undocumented, the ones that are born here to undocumented workers? That I have an issue with.
Jeez, I'm so much more concerned about American citizens right now.
This just gets into the bottom line between morally what's right for the country and whether or not, and then legally what's right.
Okay, guys, we got to go to break, and I want to jump on your last comments. I'll wait. I'll take a moment. Ahead on Fresh Outlook, there's a new offshoot of the Occupy Wall Street movement. We'll tell you all about it. Also ahead, beware of Hurricane Sandy relief scams. Stay with us. You're watching Fresh Outlook on a Brill.